Thank you for joining us for another edition of ICON Medical Billing Industry News. For a free assessment of your medical billing needs, please contact us at 888-678-5597 or visit us at our website at iconmedicalbilling.com. Today's topic is medical billing fraud. As a healthcare industry representative, ICON Medical Billing is well aware of billing Medicare claims fraud growing to an alarming scale. It is for this reason that the company puts all efforts to report any fraudulent activity suspected of happening within the medical billing community. The company is vigilant and encourages all concerned to report suspected billing Medicare fraud by contacting the Office of Inspector General or the Department of Health and Human Services for assistance. Medicare rallies for support in bringing awareness to medical billing fraud, a national issue that is siphoning the program of tons of revenue each year. The Medicare program is largely dependent on various sources that can assist them in detecting and preventing Medicare billing claims fraud, including medical professionals in the healthcare industry. Medicare fraud basically refers to knowingly and willfully billing Medicare claims in a dubious attempt to defraud money from the Medicare program. People found guilty of Medicare billing fraud are subject to expulsion from participating in the Medicare program. Additionally, fines and probable imprisonment are at stake for those engaging in this fraud scheme. The most common areas where Medicare billing fraud occurs is in billing for durable medical equipment, or DME, billing for institutional services such as hospitals, nursing homes, and hospice, and billing for doctors' services. ICON Medical Billing has identified 4 of the most popular and prevalent Medicare billing fraud schemes. The first is billing for DME. This type of Medicare billing claim involves the use of any medical equipment by patients requiring aid in their physical or medical condition. The equipment may include hospital beds, wheelchairs, and any other similar medical equipment. Fraud is committed when a provider bills Medicare for equipment that was never used or received by the patient. The most popular equipment for this type of Medicare billing claim fraud are mobility scooters. The second most popular Medicare billing fraud scheme is adding charges for medical services that were never performed. The provider bills for procedures, tests, or treatments that were never administered to the patient. These non-performed services can be easily added to a list of tests actually received by a patient. This scheme may never be noticed by Medicare. Providers can likewise report false diagnosis codes for adding unnecessary services or tests. The third common Medicare billing claim fraud is misrepresentation of the performed level of procedure or service. This type of fraud is considered upcoding charges. Providers bill more or receive higher reimbursement rates for higher levels of services or procedures performed. Upcoding also happens when a procedure performed is not included in Medicare coverage and the provider submits a bill coded for covered services to replace the service not covered by Medicare. The fourth common type of Medicare billing claim fraud is unbundling charges. Some medical services are categorized as all-inclusive. When billing Medicare claims for procedures separately, the provider is unbundling services that are supposed to be a single billed charge. For instance, instead of billing for one bilateral screening mammogram, a provider bills for two unilateral screening mammograms. Detection of medical billing fraud is never easy. However, there are certain common indicators in detecting medical billing claim fraud. One indicator would be that a practice may routinely waive deductibles and copayments for Medicare payments without checking their ability to pay. Another is when a provider charges higher rates to Medicare patients than other patients for similar services. And still another is when physicians' or medical professionals' notes or treatment documentation are missing from the medical record. Icon Medical Billing encourages all medical professionals and patients to be more vigilant about detecting medical billing